Hello and welcome to my channel. My name is Zayas. I'm a movement disorder specialist. Today we are going to talk about DAT Scan. I always try to make a video when I get the same concern or question in the clinic. Some patients or family member ask me to get a DAT Scan either because they do not believe in the diagnosis for whatever reason, or because they are not mentally ready to believe in the diagnosis and they want something objective. I will give you the five main reasons to use a DAT scan. Let me start by telling you what is a DAT scan. So the DAT scan is a nuclear medicine test to detect dopaminergic deficiency deep in the brain. Remember that dopamine is the main chemical in the brain that is low in Parkinson's disease. It's not the only one, but it's the main. So usually you go, when you are going to get this test, you go to the nuclear medicine department. They inject you with a tracer that get into the brain through a vein. And after 3 to 4 hours, they scan you to detect if you have a normal uptake of the trace or not. That's a DAT scan. Reason number one, to help providers, clinicians, to differentiate between essential tremor and Parkinsonian syndromes. I mean, neurodegenerative diseases, Parkinsonian syndromes. We have many. Please watch this video to help you to differentiate between Parkinson's disease and essential tremor. This reason number one, is the only indication approved by FDA since 2011. I want to make clear also that the DAT scan does not replace the physician clinical diagnosis, but might help to support the clinical evaluation and diagnosis confidence. DAT scan is not going to differentiate between all of these neurodegenerative diseases, such as Parkinson's disease, MSA, progressive supranuclear palsy, dementia with Lewy body. All of these diseases, they will have an abnormal DAT scan. So there is not going to help you to differentiate any of them. Watch this video explaining why some doctors or your doctor will tell you you have Parkinsonism, and the doctor is not telling you that you have Parkinson's disease. This video explains you the difference between Parkinsonism and Parkinson's disease, the differential diagnosis. I also want to tell you that the majority of the movement disorder neurologists do not use the DAT scan for this particular reason. Because typically, I would say approximately 90% of the time, you can tell by exam. Sometimes close to 10% of the time, patient might have overlapping characteristics between essential tremor and Parkinson's disease, or the symptoms are very mild. So sometimes it's kind of difficult, and this is when you can use a DAT scan. The DAT scan might be helpful in these cases. By the way, there are some patients that they might have both. They might have Parkinson's disease and essential tremor. And actually, if you have essential tremor, you are at approximately 3 to 4 times more likely to develop tremor predominant Parkinson's disease based on epidemiological studies. Reason number two, to differentiate between drug-induced or medication-induced Parkinsonism and neurodegenerative Parkinsonian syndrome. This is actually the most common reason for a movement disorder neurologist to order a DAT scan. It is almost impossible. There's no way to clinically differentiate between these two processes, drug-induced Parkinsonism and idiopathic Parkinson's disease, because they look the same. It is true that patients with drug-induced Parkinsonism, they have more symmetric presentation, less tremor, but this is when you look at large group. when you see one patient in the clinic, that doesn't apply. So DAT scan might help you to differentiate between drug-induced Parkinsonism and Parkinson's disease objectively. Reason number 3, to help to differentiate between dementia with Lewy body and Alzheimer's disease. Is actually an indicative biomarker for dementia with Lewy body. When I say biomarker, I mean objective biological marker that is a sign of abnormal process going on in your brain. So in patient with Alzheimer's, you are supposed to have a normal DAT scan, and in patient with Lewy body, abnormal. Things might get complex because there are patients with Lewy body that also they have Alzheimer's disease, so it's a mixed pathology. Things get a little bit more complex sometimes. Reason number 4, to help to differentiate between functional or psychogenic Parkinsonism versus primary Parkinsonism. We are moving away of using the word psychogenic. We like to use more the term functional. There are many reasons for that. I will tell you that functional neurological disorder are caused by a dysfunction in the way that your neurons connect with each other. So there is basically nothing structural in the brain. It is how your brain connect with each other. Your brain, your cells, your neurons connect with each other. So this is what we call this a functional neurological disorder. Usually, well, I don't want to say usually, but commonly you see some stressors, some stress, some psychiatric comorbidities with these patients, but not always. Actually, there is no need to have psychological stressors to make this diagnosis. This is a diagnosis that you make based on positive finding, not ruling out diseases. Movement disorder neurologists usually don't use too much this test to make this differentiation. Number one, because functional Parkinsonism is very rare. It's approximately 5% of all the functional movement disorder that we have. The most common one is a tremor. 30 something, almost 40% of the time is tremors. Parkinsonism is approximately 5%. So usually we don't use this test to make the diagnosis, because also is kind of easy to make the diagnosis and to differentiate between these two processes. Reason number 5, and the last one. This is probably the most common cause for me to order a DAT scan after drug-induced Parkinsonism, is to give peace of mind to patient and family. Sometimes patients and caregiver need an objective way to prove them that they have Parkinson's disease, or the opposite, that they don't have Parkinson's disease. Sometimes patients carry the diagnosis of Parkinson's disease for years without any progression, and I cannot detect Parkinsonism on exam. And they still believe that they have Parkinson's disease, so I ordered a DAT scan to objectively prove them that they don't have Parkinson's disease. Having a normal DAT scan is actually exclusion, absolute exclusion criteria for Parkinson's disease. Basically, rule out Parkinson's disease based on current criteria published in 2015. I understand it is hard to believe that Parkinson's disease is a clinical diagnosis, but Parkinson's disease is a clinical diagnosis. You actually don't need any test to make the diagnosis. But remember, the final diagnosis is made by pathology. So with the microscope, that's the final diagnosis. Patients sometimes want to see in order to believe and to move on, and that's why sometimes we order this test to give peace of mind. I see these frequently in the clinic. A patient accept the diagnosis and then they move on and really start working on improving quality of life. Finally, I just want to tell you that there are some medications that you need to taper down. Otherwise, you might have a false positive test. So it's a waste of money, waste of time. So remember, if you are taking any of those medications that you see here, tell your doctor, because they need to tell you how to taper down any of these medications before your test. Otherwise, it's going to be a false positive, or most likely will be a false positive test. Very important. If you like this video, don't forget to subscribe to my channel. Thank you very much. See you soon.